Good morning and good afternoon and good evening, and thank you for joining us for the latest iteration of the Center for Global Health seminar series that's examining building effective global health partnerships. This afternoon, we're joined by the director of the Center for Global Health, Dr. Glen Gaulton, who will be discussing the ongoing partnership between the Center for Global Health and VinMech in their efforts to establish a medical school. And with that, I will turn it over to Dr. Gaulton.
Thanks, Alejo. All right, I'm gonna hit my screen share and off we go. There we go. Okay, can you see that okay, Alejo?
We can.
All right, everyone. Well, thanks for joining us today. And as Alejo mentioned, I'm going to talk about an effort that we're working on in Vietnam to create a new, actually, it's not just a medical school, it's a College of Health Sciences, and I'll tell you a little more about it. But I titled the talk, So You Want to Create a New Medical School, because this is, I would say once about every 3 months or so, someone gets in contact with us and says, hey, we're thinking about starting a new medical school. We hear you've done this or that, and what do you think? We have to evaluate, is this something we want to get engaged with or not? Does it make sense for us? Are they thinking about it in the right way? Do they have the right kinds of resources, et cetera? So I'm really presenting our project in that context because whether or not an entity would want to do this really does depend on partnerships, which is the subject, obviously, of our spring seminar series. So why did we in the Center for Global Health think of the current partnership? And I want to take just a step back for a second and put it in the context, the decision in the context of what our overall goals and mission are about. And we're really about addressing disparities in care where we can have the biggest impact, because obviously there's needs all over the world. And then we want to listen and help others help themselves so that we help them build something, but frankly, that they sustain it. And all of our relationships, we feel very strongly, should be built on a combination of great partnerships, exciting programs, and in the end, we're empowering people. And this is both true of the folks, at Penn, as well as our partners. So where do we work? And you can go to the center website, and I know many of you have, and see the newest map that we have there. And on the right-hand side of the screen, you can scroll down on a particular place. In this instance, Botswana is what I scrolled over, and you can pick up the individuals that work there. But if you look across all of our projects, the 87 countries, the 116 projects, 122 scholars, about 300 plus different affiliated individuals, they're really spread all over. But what unites many of them is an interest in medical education. So many of the projects have something to do with medical education. And I've highlighted just a few here. So in Botswana, where we worked for over 20 years, we helped develop the curriculum for the medical school. We helped train the faculty. Similarly, for pediatric surgery and more recently, internal medicine, we're helping the university build their residency programs. In Rwanda, Dr. Schulman and many others working in oncology is helping to train the undergraduate medical students and the faculty there. We're starting a newer effort to work with the University of Global Health Equity on curriculum development. Our colleagues in cardiology in Jamaica and the Caribbean, a lot of efforts going on there. You heard, I guess it was last week, from Megan Rabarchek about her efforts along with her colleagues in emergency medicine in Bangladesh and Pakistan. And many, many, many others. You could just keep going. And pretty much every clinical discipline and many, many basic science disciplines, individual efforts in lots and lots of different countries. What's different about what I'm going to talk about today is uniting these things, because most of what we do is and again, not to minimize these things because they are very important, but are done in chunks. So we might just work on developing a pre-science curriculum or a certificate program in a clinical specialty or subspecialty. We've never really been involved in a massively comprehensive project in medical education. So this was a goal of what we wanted to accomplish in Vietnam. And I just want to take a step back. When we think about education, we really couple it to two things that distinguish Penn, at least to my mind. That is, we're absolutely dedicated to excellence, and we're very committed, as I mentioned earlier, to developing people. And when we think about Penn, because, and I'll show a slide in a few minutes about our structure, we focus both on mission and system integration. So we try both through what we do in terms of our activities to always blend clinical care with research and education, and always blend research with education and clinical care, and always blend education with both of them. So constantly working in a, I guess you would call it, you know, sort of a virtuous cycle to always have one of these entities inform the other. And from a system side, looking within our health system, we're constantly thinking of ways to combine domains. Clinical departments and basics departments is a good example shown here in the neuroscience service line, and to unite that with research. So we work a great deal on integration between domains and approaches. And it's really, I think, one of the distinguishing features of Penn, and what's catapulted us in many ways to so many great, what I guess I would, you know, in current vernacular, describe as translational research. And everybody sees these things, right? So we have advanced clinical care in really every major domain, every specialty, and even every subspecialty. Our trainees, both at the graduate and clinical level, and from junior to senior trainees, are widely recognized as exceptional and are always in high demand. You know, approaching $1 billion every year in extramural research funding. You know, hundreds, if not 1,000 clinical trials happening at any one time or another. Numerous papers in top journals. Over 20 startups every year, 15 approved FDA drugs in the last 5 years. I mean, folks see this, and that's what draws them to places like Penn. And of course, it's not just Penn, but they're drawn because they say, this is what we want to build. And then I always take a step back and I say, that's great. But just remember that that took us 30 years. The current iteration of what's happening at Penn all started with strategic planning at about 1990-ish, or 1987 probably is a more fair time to think about when it started, when Bill Kelly came to Penn, and then through Arthur Rubenstein, and of course now through Larry Jameson. So this was a constant development over 30 years, built on a base of 200 years of excellence with super strong leaders, a focused strategic plan, incredible people, and billions in resources. So I think it's great that people want to emulate us. You want to hit those targets, but it's also very, very important that there's a a measure of realism cast in whatever people hope to accomplish. I often focus when I talk about Penn and the advantages about our structure, that we are both a combined school on the left side of the screen and a health system, and the health system is even bigger than the one shown here, and how we unite all of these things together, and it all reports up to one individual, the executive vice dean and executive vice president and dean of the School of Medicine, Dr. Jameson. But the structure is great, but it really is about the people, and it's about the leadership at the university level, and president's office, the provost's office, the dean, the leaders of the different domains, our clinical chairs, our center and institute directors, the heads of the hospital, and all the individuals who populate the key positions throughout the organization. Their ability to work together, their ability to listen to each other, respect each other, and to talk to each other so that we remain connected. That's what distinguishes us more than any single structure. So, because there really are very, very few places in the world that would have a structure like this, but you can get to the benefits of the structure if you've got great people who are committed to unifying the different components. And this single feature shown in the slide of a School of Medicine on one side and a health system on the other turn out to be, if not certainly one of the two most difficult challenges to deal with when you're creating a medical school or a nursing school or residency training programs. And that's because the majority of training of doctors and nurses occurs in the clinical setting, not in a classroom. And so while structurally it may sit under a school of medicine or a college of medicine, physically, and when we think about where the educators are, they're going to be primarily in a healthcare setting. And that's much more difficult to control. And a great deal of focus needs always to be put on that component. So with all this in mind, going back now 5+ years, we were looking, we wanted to have a unified medical education strategy, and we were looking for a partner to launch a comprehensive effort in medical education that would span, and we were thinking mostly just about physicians at that point, but that would span undergraduate medical education to graduate, UME to GME. And we also wanted to increase our presence in Southeast Asia, where we had done previously a lot of work in China, but not so much in the surrounding regions, at least as contrasted to, say, Latin America or certainly sub-Saharan Africa. And we were approached, and we approached several people about opportunities that just didn't make sense for us until we were approached by the Vin Group Corporation to create their desire to create a new private university called VinUniversity. So a little bit about the Vin Group very, very quickly. They have three main, so this is the largest private corporation in Vietnam. It's a joint, so-called joint stock company. They have many subsidiaries, but their subsidiaries fall into three brackets shown here: technology and industry, trade and services, and social enterprise. So an example of technology and industry would be that they have made the first cars in Vietnam, designed and manufactured in Vietnam. And indeed, they're going to be released in the United States the next year. Trade and services. They do a lot of real estate development, both urban development, new homes, and also resorts. So they're very big in that sector. And social enterprise, historically, and many of these are held in a not-for-profit structure. They run the Vin schools. These are K through 12, private K through 12 school system spread throughout Vietnam, north to south. Probably get the numbers wrong, but last I checked, it was 50 to 60,000 young adults in the school system. The Vin Mec health system, which when we began had 6 hospitals. Now there's a couple more. And again, north to south in Vietnam. And this is where the university fell, that to couple the efforts, both in nurturing individuals up through their primary education to then create a university that would be to a standard higher than what had heretofore been seen in Vietnam, and to link this with components of the university that were related to health sciences. So here's just a little, this is on the cover page of one of our little flyers. So the Vietnam Project created what I like to call an alliance to establish a new university in Hanoi, Vietnam, VinUniversity. And our charge was to guide formation of the College of Health Sciences. There are other colleges, 2 other colleges. The partner on those, I'll shorten them by simply saying business and engineering and computer science. And the partner on those, building those 2 colleges, is Cornell University. Now, in addition to building and helping working with the Vin Group to build the College of Health Sciences, in parallel, shown at the bottom of the slide, we were also working with their health system to guide the development of clinical excellence. So why this partner when we had said no to several others? And the main reasons are shown here. First is that the overarching goals were aligned with our global mission. So Vietnam has a population of roughly 96 million folks, limited preventative medicine, large disparities in care access, and inconsistent qualities of care provision. And our goal was to help develop a new way of thinking about medical education in Vietnam that would be tied to training individuals more in a standard that you would see in the West in terms of evidence-based medicine and really assessment of scholarship, and that the effort would be tied to scholarship. And we view this as an opportunity not just to do a great job of creating a new College of Health Sciences, but also to establish a regional national, if not regional model of health profession training and excellence in care, setting a standard, if you will, for the country of Vietnam as a whole, to help guide the other medical schools in Vietnam. And there are many, the majority of them being public, and some of them pretty good. Actually, I shouldn't say pretty good, some of them very good, but assessing, training and assessing their graduates in a different way than we might see, for example, at Penn. This also was an excellent fit to our broader goals in that the project spanned undergraduate medicine and to graduate, and indeed included nursing in the project. So this was also developing an undergraduate nursing program. It's a great opportunity to engage and coalesce our faculty and trainees, and it established our brand in Southeast Asia. And the Vin Group, why the Vin Group? And you'll hear in a minute from my colleague, Lynn. They had an absolute commitment to excellence. Their time frame for achieving goals was reasonable. The company has a very, very solid reputation. They're well connected with the government agencies, substantial fiscal resources. They have experience in the health sector. That is, they own the VinMec health system, which would become the teaching hospitals. Experience in education, although at a primary level, the Vin schools. They did understand the complexity and cost. They had done a fair amount of work before speaking with us. And they wanted our engagement to establish their medical school, not to supplant Penn in Hanoi. And maybe in the end, the biggest deciding factor for me, they had a super talented and inspiring leadership team engaged in the project. So I just want to take a sort of a different kind of a step back, not talking about Penn, but also if you think about building a medical school, there's or a health science school, there's a couple of models, and I always like to describe it as the two extremes. On one extreme is very focused, and again, I'm not judging any of these. They can all be appropriate at different times with different partners. One is very focused training in a narrow domain area because a need might exist, for example, in emergency medicine. Or that you would be providing broad advice, but providing consulting advice, that is, advising them on what to do, but not really being involved in implementation. And of course, this is most relationships, not just at Penn, but around the world. These are usually highly focused. They sometimes can provide assessment, product, or a service or advice, but the services are limited, and obligation for implementation or outcome assessment is usually not there. So there are pros and cons to this. It's fast, precise. It does have a limited scope and duration, so you know what you're getting into. But you have essentially poor to no control over the outcome. So if you really want to influence things, this is a tough one to use because again, you really don't have much control over the final products. The other extreme would be to establish your home university in another location, in what I'll call a satellite campus. So there are two very good examples and successful ones of this in medical education: Duke, National University of Singapore and US, and Cornell Qatar. And so this is the entity is approved by the founder, but all the that is the supplier of the funds, but all the operational elements are designed, staffed, and run by the US partner. In this case, these are US, often by giving them also US-based degrees. So this is basically transplanting, and too harsh a way to say it, but essentially transplanting your institution in a new location. Again, the pros and cons, you have complete control, basically. Greater assurance of quality, easily delineated branding, because again, usually these entities are, both names are right up front. They almost always have a large revenue stream associated with them as sometimes a gift or an endowment up front to start the venture, as well as ongoing expenses. So these are expensive for the funder. It creates a heavy institutional burden, however, on the home institution, the US institution in this case, because you're really starting up a whole nother venture. And, in both of these cases, these are medical schools, it's a lot of people, a lot of staff, a lot of faculty, et cetera, et cetera. You do also have the potential in these models, I think, to lose a global health mission focus. That is, because you're spending so much time on operations of the entity that maybe you're not always thinking about, or you're really solving the health problems of the local environment. They do have significant carrying costs, as I mentioned. And at some point, every one of these that I've ever seen needs to be unwound, meaning they revert away from the partners and return back to the local funder and local entity, and that can sometimes be difficult. Okay, so we have always focused, and it's a bit of a bias of mine, I confess, on what I'm going to call the Goldilocks middle ground, which is really more of an alliance and a partnership, which spans somewhere between the two models I've described, so that the system is and the institution is jointly developed, but the primary owner is the local entity. It's funded by the partner or by a combination of partner resources and external resources, or shared in some measure. The degree of engagement by the partner, in this case Penn, is extensive in design and content and initial delivery, but operations are largely and sequentially the responsibility of the on-site founder. And branding is by association, not by direct naming. So when you'll see in the Vietnam case, it's the curriculum is prepared by Penn, but it's VinUniversity. It's not Vin/Penn Medical School or Vin/Cornell. It's their university. So there's no direct naming on the branding on the university, and there's no joint degree awards. These are their degrees delivered in their country. So the pros. Sequentially develops talent, thus sustainable, which is great. On-site control of management, which is great. Assurance of quality by the institution, in this case Penn, which is nice. Success requires well-delineated tasks, because there's a lot of movement in this, goals and roles, which is great. It's comprehensive, but it's also well-defined. So there is a limited risk for, say, a US institution in beginning this, because you know exactly what you're getting into. There are cons, very, very challenging to manage. When do you do a little bit, and when do you do a deep dive? And we'll see this in our programs. It requires very, very strong leadership and partner trust, communication, and flexibility. And I will say that if there is a challenge, and you'll hear in a minute about this, in our relationship in Vietnam, this was one of the biggest challenges, of course, of the pandemic. Not being able to go to Vietnam made that communication and flexibility, more difficult to manage. So the project was begun in the very tail end of 17. I'm dividing it into 4 phases here. The structure of the funding and contract is a little different than this, but for our purposes, 4 phases. A planning phase where we help design the project together with our colleagues in Vietnam, develop the cost, the structure of the institution, all of the institutional documents, et cetera, and then recruited the leaders. And this involved both undergraduate medicine, as I mentioned, undergraduate nursing, and graduate medicine, and as well building components within the VinMec hospital environment. I should say pretty early on, the hospital shifted to a slightly different model, which was, rather than being more broadly focused on developing hospital quality, it focused on developing a center of excellence, now exclusively focused in oncology, as an example of how to build targeted excellence. So that went for roughly 17 to 19. In 2019, then, the effort went past the planning phase and was essentially launched. Penn developed the curriculum for the first 3 years in each of the 3 main degree-based areas. We helped train key staff, although we helped recruit the leaders, but they recruited the staff. We've been training and mentoring educators, et cetera, et cetera. Helped set the guidelines for admission, but they ran admissions. And then we track the outcomes. And all of this, again, is linked to a detailed scope of work, tasks, timelines, deliverables, all defined from the planning phase. And this worked pretty well, I have to say. People have asked me, I'd sort of give it a B+, A-. I'm a hard grader, so I could think of a lot of things that could be better, but it actually worked quite well. And we're now in what I'm going to call phase 3, which is we're returning to live activities, which is great. So I've been twice this year, and others have been once. So we're continuing recruitment of new classes, developing the back end of the curriculum, which is a more clinical-based curriculum, placing a much greater emphasis on training of the faculty in a live fashion and student engagement, which turn out to be limitations from the past, et cetera, et cetera. You can see the rest on the slide. And again, all of this, I should have mentioned this before, is funded basically by a contract grant from the founding entity, the Vin Group. Phase 4, we'll eventually get to that after the first classes graduate, to be determined exactly what it'll be, but probably tweaking the curriculum, further faculty development, maybe a little more research development at that point, and then certainly accreditation and outcomes track. So the initial project team was listed here. We originally had 5 teams. 3 of them remain largely unchanged. So the 3 on the left, undergraduate medical education led by Gail, undergraduate nursing by Julie, graduate medicine by Lisa. Clinical quality and outcomes at a broad level was led by Lee, and I was doing research. And to be blunt, the focus shifted much more to the first 3. So those 2 on the right kind of phased out. And we had a dedicated project team. That team has changed in a couple of iterations. And of course, in any project that spans this many years, you are going to have turnover. And so here's the current effort. There now are 4 project teams, the 3 that remain, UME, UNE, GME. We've added, instead of a broad definition, a focused effort on oncology that's led by Dr. Selena Luger. And the current project management is shown down below with Ashley, Darren, Kirsten, and I serve as the overall project director. A lot of good things have happened. And one of the main goals was engaging Penn individuals who had never been involved in global work before, engaging them in this work. And you can see the numbers here. 16 staff, 200 plus medical students, residents, fellows, over 70 faculty. We have a small number of people on site, particularly in the clinical areas, because we felt that was necessary, where they had the least amount of training and the least ability to identify individuals who would understand the graduate medical education side. We made a lot of visits, completed 2 admission cycles, and the trainees are doing great. So that's my view. And I'm now going to link us into a conversation with Dr. Le Cu, Lin. So his first name is Lin. They list the last name first, middle, then first. He's the Vice Dean of the VinUniversity College of Health Sciences. And Lin's been my partner from the very beginning in the relationship. So Alejo, if you could play the video.
You guys can see the video screen?
Well, I'm joined today
Okay.
by Dr. Le Cu Lin, and Lin is my immediate counterpart in the relationship that I've been describing to you this morning. Indeed, from the very first time I was ever in Vietnam, I met Lin, and together with him, we mapped out the project and all the details, and we continue to meet weekly. And certainly when I'm in Vietnam on a daily basis to talk about the project and how it's going and to just continually, make it better and better. And I have to say, he's just been an incredible partner in this. And I hope he would say the same about me, but I have no hesitation saying this wouldn't be happening without Lin. So thank you, Lin. Lin is currently the Vice Dean in the College of Health Sciences at the newly established Vin University. And in that role, in addition to managing our project, he has many, many other responsibilities in the college and with the university, integrating the programs that we're helping them with, but also, many other things, of course, as I've been describing, that they are doing there in Vietnam, where they take the lead. Not Penn. So I've prepared a few questions to talk to Lin about that I think describe and to give him the opportunity to describe the relationship from the perspective, not of Penn, but of our colleagues in Vietnam. So Lin, Why don't we begin by taking us through what the Vin Group was thinking when they initiated the search for a partner in creating the College of Health Sciences in VinUniversity. For example, what were sort of the prime criteria that we were looking for in a partner? How did you evaluate the different partners and the bids that they put in? And in the end, what was sort of, what were maybe the one or two main reasons that you decided to choose Penn as your partner?
Sure, thank you, Glenn. As you know, we wanted to find a partner to help us build universities of excellence. So certainly it has to be a world-class institution. And in our strategic plan, we want to develop VinUni so that, first of all, it would help to provide not a regular universities, but kind of like world-class universities in the future. And certainly it has to be something that contribute to Vietnam medical education, nursing education, and the healthcare system development as a whole. So it is not an easy task. So certainly the partner should have both the long histories of outstanding academic qualities and high ranking in academic medicines as well as hospital system. So I think more importantly, we look at the vision, the missions, and the willingness to collaborate with Vin Group in this project, because we anticipated that this is not an easy project. We need long-term partners who share values and have some kind of like alignment. As you know, we do want to kind of like revolutionize the health science educations in Vietnam, in medicine, in nursing, not only medicine, obviously. So then certainly we evaluated different potential partners based on their ranking in nursing, in medicine, in medical educations. We also look at the hospital and kind of like health system ranking, and certainly within the US, this is quite doable. And we look at the team and the leadership. We want to make sure that we get the support from the highest levels of leadership of the universities, of the partners, and the hospital system. So then we have a few partners, potential partners, I mean, and we look at all of the criteria, and we want to see the alignment between their own strategies and our own strategies and expectations. So that's the main, criteria, I would say. And about Penn, well, certainly among those finalized, kind of like final list of candidates, potential partners, we have at least 3 top partners, I think, top potential partners. We've been very impressed, certainly by the long-standing kind of like traditions of medical and nursing educations, as well as the healthcare system that Penn already developed for years. And the leadership, the commitment that we see in the core team members, the leaders. So those are the key factors that, we made the decision.
Great, thanks, Lynn. When we came to the project, oh, and I should say, by the way, and I will be saying this a little later in the talk, from our side, it was the synchrony between the leaders and the vision that really was the reason we, on our side, were excited about the project, because, things are always going to come up and you got to sort them out. And, if you have a great, you share the philosophy of what you want to build and you have good relationships, you can work through things. And I think that's proven to be true in our project. When we came to the project, the Vin Group and the project was actually, you guys had done a lot of work ahead of time. We were very impressed with the diligence that you did in thinking this through. So, we've been touching on this just a little bit already. So these relationships, this is a very, very big project, as both you and I know, and balances, and I will have described all the different components, before this chat that the others are now hearing. But how would you gauge the relative contributions, or maybe, importance of the different aspects of managing the project and the management principles, the communication, and the leadership in ensuring that the project comes forward? What about comparing those three three key components: management, communications, leadership?
Well, I would say that all of those aspects are so important. I think it is extremely important to have strong commitment from our leaders. I mean, from both sides, and that's the very first step. If we don't have commitment and we don't have the strong leadership from day one, then there's no way we can move on and make sure that everything on track. And then certainly we need to maintain clear structures of management. We have to set up a good system so that we can keep tracks of things and make it lean, but also effective enough so that we can engage people and the core team leaders and the staff from both sides. And I think this is really challenging because, as you know, Penn, together with us, not only want to build universities, I mean the health science from scratch, but also we want to build the academic healthcare system, I mean to support VinMec, and together VinMec and VinUni to create something in high quality for the first times in Vietnam with international standard. So that requires a huge amount of management and kind of like engagement, not only of the academic people, academic staff, but also the clinical team and the hospital setting. And then I think certainly the mutual understanding between both sides is crucial, and the communication between the two teams is extremely important as well. Certainly there are differences, cultural differences, and then the corporate approach, the academic approach. But so I think we have to try our best. And one of the key points is each, I would say, core team or sub team needs someone as a champion in each side, so then people can connect with each other and maintain a very strong, relationship.
Yeah, thanks for saying that last point, particularly because, again, this is something I mentioned briefly just before. The listeners today will see the tape. We had clearly established teams in each domain area, and every one of the people from the Penn side has a counterpart within the university and within the health system. And I also touch on in my presentation on the challenges that are unique to medical education, because it isn't just teaching in a university environment. More than half of the teaching occurs, as you well know as a physician yourself, in the clinical environment.
Right.
And that balance between education in these two very, very different settings, and education delivered in a different way in many cases, with different structures and people, leadership teams. I mean, this is something I think that a lot of people don't think through when they think about starting new medical schools, or even, building individual programs like a residency program in, say, medicine or pediatrics. They don't think through the complexity always of, the absolute importance of not just having the pure academic component, but having the clinical setting fully on board. And that's something I was always, again, in the beginning, we were impressed by, obviously in the university, now President Milan and Ms. Tuyon from the VinMec side. I mean, just tremendous leaders who were absolutely committed. So that was, I'm editorializing a little here, but that was just a huge plus. That said, you also mentioned culture. And so I've been to Vietnam many, many times. I've never lived in Vietnam for a prolonged period. And there are waves where I think, well, I'm starting to understand the Vietnamese culture and Vietnamese people. But then I realize I have no clue. And you spend time in the United States, much more than I've spent in Vietnam. Is it ever really possible for us to truly understand the cultural implications and how we interact with each other? Or do you think we've just got to trust each other and maintain our appropriate sensitivities and keep them in check?
Well, yeah, that's a good question. I've never thought about that. I mean, quite seriously. And now you reminded me that I spent time in the U.S. and you spent time, even short time, but so many short trips in Vietnam. But still, it is not easy to fully understand. So I think in the end, we certainly need to rely on trust among the senior leaders. So then we recognize and protect the relationship. I think we should, and in a way we have to get the consensus on the kind of like big pictures issues, the goal, the major expectations from both sides, and then those outcomes should be clearly defined and agreed upon. And then each team need to work out internally. I mean, we have to take care of the internal issues, any kind of like, bureaucracy, I would say, or red tapes in each side, and then make sure that we can function well, given our own culture and the local context. So there are constraints from both sides. But I also think that at some point, we may want to sit down and listen to each other's and have open discussions so that we don't misunderstand one another's, and then we can try to solve problem that is still coming up at some point. Obviously, there's no way that we can have a very smooth project. Still, it is a bumpy road because we are all learning to do something brand new for the very first time, I would say, at least in my case.
Yeah. Well, this is the scope of this project. This is the biggest and most inclusive project we've ever done as well. And so we're learning as well, but we're also learning in the context of Vietnam, which is very, very different culturally than the other places that we've worked. And I will be describing some of those differences as I see them between the different places that we work around the world. So the last question, given the limited amount of time that we have, what's the, looking at things now, and you look back over the last couple of years of the relationship, what's been the most challenging aspect in supporting the relationship, and sort of, on the sort of related side, has there been anything, I'm sure there has at different times, that's been frustrating to do with having Penn as a partner? So walk us through that, if you would.
I think it takes time. It takes time to explain to Penn partners and team members how things function, how things work here at Vin Group and VinUni. And I think we also have a very unique situation that I'm sure now, Glenn, you understand from your standpoint and from your time working with us, is that Vin Group like a mothership, so which is a corporate culture. But VinUni, we want to build the academic environments, and certainly still influenced by the group. So it is not easy and not the same like many other institutions in Vietnam as well as overseas. So how we operate, what are our expectations? Sometimes the paperwork and procedures and those kind of things are tedious and time consuming and challenging, if not like frustrating for both sides. And I'm sorry about that. Certainly Penn also have some impressions about what we've been doing here in Vietnam, the way we work things out, and the way we get things done, review, and those kind of approval processes. All of those things, I think we have to overcome. So that's a little bit as a challenge for sure. Talking about frustrating aspect, I don't have something like very major in mind, but some minor, I would say is maybe because of the different kind of like working style. So sometimes in a way, some document or report or kind of like thing prepared by Penn colleagues, and not always, of course, but sometimes Penn team member tend to kind of prepare and share long documents or reports that regarding the outcomes or deliverable. So Vin Group and VinUni on the other side, we actually, our team and the leaders here, of course, they usually prefer something short and straight to the point kind of approach. And for those kind of report and deliverable, maybe what they really want to see is just as a final outcome, and what did we get done together, very short and simple. And what Penn experts or even sometimes program directors like the GME program director, when they get something done and then they kind of like write something in a long, document, oh, did this, we did that, and we don't need to see so much of detail. We just want to see the end point. So it is not always easy to explain to the expert, to the program directors, because maybe that's the way they think that, okay, they should come up with as many detail as possible. But sometimes I think it's not necessary, and it is time consuming for them. And we don't want them to do that. We don't want them to spend time on that. So it's kind of like a minor, I would say,
it's a good point.
Administrative details. Yes.
Yeah, no, it's a really good point. Yeah, and it's and by the way, folks listening, Lynn and I did not rehearse the answers ahead of time, but he gave exactly the answer I would have given to this from our side, and that I'll touch on later. Which is the difference between a culture that comes from a purely academic background and a culture that's a blended background now of a corporate culture blending to an academic culture, and the challenges in that. And there, I have to say, it is a challenge at times because we just don't think and reports is a really good example of that, because that is very typical of an academic institution to write very detailed things. It reminds me that we should always have an executive summary at the beginning, which I try to do in mine at least. So I understand that now pretty well. I think it's difficult for me to, and I work continuously to try to get other members of the team to try to appreciate that, that just the perspective that the folks working in the Vin group system, the parent organization, is just going to be inherently different. It's not better or worse, it's just different. And we've got to respect that, I think, is the main thing, because otherwise we're putting you in a very, very difficult situation. And when people have partnerships, there's going to be all kinds of different partnerships. Sometimes we work directly with ministries of health or education. Sometimes we're working with other academic institutions, and sometimes we're working with corporate sponsors. And I think, this seminar series this spring is all about the different kinds of partnerships. It's incumbent on us to be respectful of our partners. And but you hit exactly what I would say is the biggest adjustment, I guess, is the way I would say it. Now, that all said, it's actually helped me seeing the discipline that you guys have. It's taught me that maybe it's a little more than I think we should do in terms of the pre-planning and the deliverables, but the structure that we create by having very precise deliverables and debating them and engaging people in that and then evaluating them creates a lot of discipline around the project and eliminates ambiguity in the end about what we accomplished. And that, again, that isn't a very academic thing to do, to lay out things so detailed in the beginning. So I actually think that's been a plus. It can be at times frustrating, but in the end, there's a benefit to it. So we've come to respect the approach that you guys have taken. So we appreciate that. Thanks again for spending time with us this morning. And I look forward, I'll see you in July during my visit.
Sure.
All right. Take care. Bye-bye.
Thank you.
So sorry, everyone. So that we weren't sure exactly how long that was going to go. So, and I only have 2 more slides. So I'll cut kind of to the chase here. So we've got lots of positives to the relationship, many accomplishments. The university is off to a great start. We built wonderful relationships. You saw Lynn has become a very good friend over the last few years. Huge engagement by Penn people across an entire spectrum. So we definitely accomplished those goals. There are challenges. The main one being finding talented faculty to serve on the ground in the graduate medical education and the Center of Excellence programs. It's asking a lot for people from a US background and training to take a chunk of their lives and be full-time overseas in a very, very different environment. The second one is that, if anything, the Vin group moves too quickly on their own. And I contrast that to some other places where we work where the movement never seems to occur. So I would rather have this problem, but we frequently finding ourselves, and we're straightforward with them about this, just slow down just a bit and do a little more strategic planning and thought. And the last couple, we touched on this throughout the talk, and Lynn touched on it as well. This hospital university environment difference, very, very different. and the different environment of a corporate culture in the Vin group versus academics. And, that's just the nature of having different partners and respecting each other. So when you are thinking about starting a big enterprise, like a new school or a new college or a new university, I don't think there's really, or maybe any relationship, there's not one model that is the right model, and no model fits everything perfectly. You really need to describe what you're trying to build and then put the model and the approach in after you describe, well, what is it you really want to accomplish? And choose the one that depends, that is going to give you the best outcome and that meshes best with the two partners and their style. And particularly ownership is a big thing. The Vin group really wanted to own VinUniversity. They wanted it to be theirs. And that was great because it's exactly what we wanted. And clearly all of these things have to be blended with the various ministries. You've got to think about the existing infrastructure, matching goals to realities. And of course, in the end, the facilities, the branding, the financing, I will just say this about those last three things, which we tend to put off to the end. They're never exactly what you think they are when you're describing them, because the project will change so much over time, particularly a project as big as this one. Okay, so that's the end of my talk today. And I think we've got just a couple minutes for questions if anybody has any.
Thank you very much, Glenn, for that presentation and the overview of this very extensive and complicated partnership. And thank you again to Len for joining us. If anybody has any questions, if you could kindly place them either in the chat box Q&A, or if you'd like to address Dr. Gaulton directly, raise your hand and I'll go ahead and unmute you. So while we're waiting for that, Glenn, I did have a question. You kind of alluded to some things that you would have changed, or things that developed throughout the partnership that you, I don't know, really enjoyed and helped the process. But say you had to restart this thing from day one. What would be the biggest change? Knowing all of the successes and, downturns that you've experienced, what would you, tell your past self?
Yeah, so this project started even bigger than it is now, because it was building the university, but also trying to build quality within the VinMec health system broadly. And that was too much, to be blunt. That was just too much to take on at once. And even they recognized that after a little bit, because the cultures and what the university wanted to build and what the university and what the health system wanted were very different. The health system, even though it's in a not-for-profit structure, has to maintain a profit margin to keep running, even in a not-for-profit structure. You obviously got to pay the bills. And so I'd say, that was a little too much. And I think we're at a better place now, focusing just on the oncology domain. But even that's a challenge. So I'd say that's one thing, is that we bit off a bit too much, both on the clinical side. Now, we had to work in the clinical space somewhat because we had to train the clinical preceptors, et cetera. But I think you can do that without doing pure clinical service. I think the other, and this is more of a pandemic related thing, we needed to spend, so we developed a great curriculum, but we relied on the people there to teach it. And because we weren't able to be there during the pandemic, we weren't able to do much on the ground coaching and teaching, coaching of how to teach the curriculum. And I think that's proven, that's definitely proven to be a bit of a challenge. That the curriculum that we've prepared needs to be delivered in a very interactive way and style, and that you have to acclimatize both the faculty and the students actually to that. So that's something we're working on now. I think those are probably the two biggest things. Okay.
So no questions in the chat. I do have another question. It's kind of geared towards sustainability. So, as you've alluded, this is a very involved partnership, both in terms of human resources, but also financial. So what would you recommend to any individual that's looking to, have a more significant partnership geared around medical education, or on the flip side, we have somebody from a lower middle income country that wants to partner, but doesn't necessarily have the financial means like VinMec does.
Yeah.
So how do you envision this type of model being accessible to those other partners?
Yeah. So resources are a big part of this, clearly, because this was an enormous lift in developing the entire curriculum, engaging people. I think if the funding hadn't been there up front as much as it was in this particular project, we still would have done it, I believe, but we would have done it in chunks. So we wouldn't have done, maybe we would have just done the medical school or just the nursing school or just the resident. We wouldn't have been able to do the big comprehensive thing. But I think I should say because just starting a medical school is a pretty big job of its own. I think you can do a medical school. The good news now is because we've been through this one, we've learned an enormous amount, and we have a lot of material that we would have to adapt to every new situation, but we have the material now, and we've learned how to prepare it in the right way, present it in the right way. We've developed training programs for the educators. So, the first time around just took a lot more work in many, many, many sectors. But I think we're through a lot of that. So, and you just have to be realistic about what the partners want and what their resources are. And there's some partners that don't have any resources to share, and they expect us to be providing things gratis. And we can do that, but, in limited chunks. So, so it just has to be parsed out in a very, very different kind of way.
Okay, thank you for that. There is a question in the chat here. From Aziza. She says, nice presentation. How does UPenn cope with the cultural aspects with their different partners from different corners of the world?
Yeah. So thank you, Aziza, for the question. So first of all, it just time and effort has to be spent understanding as best one can what those cultural differences are. So that's the first part. Just there are going to be there are for sure differences culturally. And so a lot of attention has to be paid early on to bring that in as quickly as possible. So that's the first thing, I think, is awareness of the differences and then sensitivity to the differences. And then I think that's, as I mentioned, a big part of the leadership team's responsibility. That is having the ability to have people on both sides. So in the case of Vietnam, it's me on my side, Lynn, and Dr. Mauricio Trevistan, who's the dean of the college. That Lynn, Maurizio, and I, we speak very, very directly to each other. I mean, frankly, directly, and that's critical, particularly Lynn, for the cultural differences, because he, being Vietnamese, can really help us understand what those are, how something that we might present in a certain way would be received by another party, even though we might have intended it to be something different than the way it came across, for example. So it's a combination of awareness, paying a lot of attention, and being emotionally, what we call emotional intelligence, and then having a really, really good partnership team that can constantly be educating each other about what works and what doesn't work. And it goes both ways, by the way. I mean, we do the same with that with the folks in Vietnam, that when you interact with our colleagues at Penn, this is what they will expect of you. So it's, it's both ways. But yeah, I think as long as you are, aware. But boy, I take our two biggest projects, Vietnam and Botswana, and you could not be more different than those two cultures, in my opinion. And so it's been a really good and valuable lesson on cultural sensitivity. And both are going well, just in very, very different ways.
Thank you very much. I do want to be respectful of everyone's time. We are at the top of the hour. If there's any last minute questions, feel free to send them directly to the Center for Global Health's website, email address, excuse me. And with that, I'll let everybody go and enjoy the rest of your day. Thank you very much, Glenn.
Thanks, Alejo. Bye, everyone.